Hello, Assalamualaikum, ladies and gentlemen. Welcome to another episode of the Dental Talk, and welcome to our new ANDC podcast series. Today, we have Dr. Nabeel Zahid with us. He is the assistant professor and head of department of endodontics at Azra Nahid Dental College. He is a graduate of LMDC. He's also a member of the Faculty of Dentistry at the Royal College of Surgeons of Edinburgh, and he's also completed his MDS training, and then he's now also the first Pakistani qualified M.Endo of Pakistan. Am I right, sir?
Yeah, that's pretty much correct.
All right. If I'm missing some, and he has many publications to his name and attended and lectured at many conferences as well. Thank you so much for joining us, sir. I hope you're doing well. Thank you so much for taking time out.
Ji, Assalamu alaikum. Thank you for having me on your podcast. It's truly a nice platform that you've set up here, and I think it's a really nice venture based on the changing times. I think it's really nice and interactive that you have so many different people. And I've actually been following your channel recently when you've had Tucker on your show as
Oh,
well. So that was really
thank you
nice.
so much, sir. Thank you so much. Means a lot. So, with your permission, should we start the questions?
Yeah, go ahead, please.
All right, perfect. Sir, जरा थोड़ा पीछे से शुरू करते हैं. Tell us how you got into dentistry and what were those undergraduate years like?
Yeah, so I don't think there is much. I don't think the story is that really interesting, but there was some sort of inspiration for me growing up when I was at a very young age. मतलब कि
Okay.
teenage से भी पहले. Oh, it sounds very stereotypical, लेकिन बस कुछ family doctors and कुछ
Okay.
experiences को देख के I
Hmm.
was really inspired by the stature doctors had within our community and the
Okay.
level of respect that they commanded and just the sheer knowledge that
Hmm.
they had that nobody else knew about, right? So when
Hmm.
they were talking, वो कोई ऐसी बात कर रहे थे जो जिसके बारे में उनको पता है and the layman doesn't quite know much about it. So इससे काफी interest develop हुआ.
Right.
Just the simple act of going to the doctor with my parents at a young age, पहले तो वो pediatrician था, तो it was very fascinating ना कि यार
Sure.
वो पता
Okay.
नहीं इसको क्या ऐसा आता है. So I want to learn something like that, and I
Okay.
want this life. I want the white coat and the
Oh, okay.
dealing with patients,
Very
things like that.
interesting.
Later on, when it was time to decide which field to choose, I think it was a calculated decision
Mm-hmm.
based on the lifestyle of doctors, medicine versus dentistry.
Yeah.
के
Mm.
इस side में थोड़ा artistic sense भी है, and everyone is practically a surgeon, so I like
Yeah.
to work with my hands rather than just being a physician.
Yeah.
And working hours, calls, emergencies, things like that, उसको मैंने कुछ avoid करने के लिए just went to a balanced approach, in which in my opinion was dentistry. So
Okay.
yeah, that's pretty much it about the choice. Undergrad experience was really a brilliant time. I think it was the
Mm-hmm.
best time of my youth,
Hmm.
rather. क्योंकि I grew up in Saudi Arabia, so I had
Okay.
my entire schooling in Saudi Arabia.
Oh,
So
okay.
Pakistan, I am just like all the expat children
Hmm.
that they come back to Pakistan or they move abroad. So I came to Pakistan for doing medicine or dentistry. Got admission into LMDC. It was a completely new environment, नए लोग, नई जगह, और yeah, I think that has to be the best 4 years that I spent
Chal.
that I can remember.
Perfect, sir. Sir, once you're done with dentistry, you did your post-grad in operative dentistry.
Yeah.
Why did you specifically choose operative dentistry?
Well, again, not to take anything away from any other specialty, right? But
Mm.
if you fundamentally look at dentistry, so it is operative dentistry. It covers 80% of
Yeah,
problems associated with
absolutely.
any practice, right?
Absolutely.
And उसकी reason ये भी थी कि during undergrad years, although we had a lot of exposure to treating patients,
Mm-hmm.
but at that time, I just felt that I'm not very confident, particularly in doing endodontic treatment, since
Okay.
you only get to do it in house jobs or वो छोटी सी rotation होती है.
Yeah.
So that part, I just felt that I just didn't know how to do it. So it came from rather a fear of not being able to
Not being
do
able
good.
to. Hmm.
Yeah, so and it's pain control, right? Everybody
Yeah.
has dental ache at some point in time. So I
Yeah.
just want to be really good at that. And I've seen a couple of endodontists, particularly those abroad, that they use a microscope or wo itna
Yeah.
sa daant hai, and there's like a whole world
Well,
inside it. And I was just sold on that idea that there's someone who knows how to navigate, in this small of a space with that level of intricacy and expertise. So yeah, it was never a difficult
no,
choice
this
for
is
me
such
to
a
choose
difference of
endo.
opinion because personally, I have such a huge problem with this fact that इतनी सी जगह में आप काम कैसे करते हैं, and that's why doing root canals used to give me anxiety, not anymore. अब थोड़ा बहुत बंदा confident हो जाता है with time, but it's still a very an anxiety inducing procedure कि इतनी सी जगह में is it clean, is it not clean. So
Yeah.
yeah, I understand where
I
you're
mean,
coming from.
trust me, देखो, uh, for an endodontist to be an endodontist, right, he needs to have his tools. Okay? He
Yeah.
can't be an endodontist without the right tools. When you bring in magnification, right, it's a
Yeah.
game changer completely. And I had the opportunity to train under a microscope in University of Lahore.
Oh.
So when you actually start using a microscope, ना जो आप सारी text bookish बातें पढ़ते हैं ना about anatomy and textures and color
Yeah.
changes, then you actually get to see it and you
Yeah.
actually get to feel it, right?
Yeah.
So obviously जब आपकी completely perspective ही change हो जाता है, so then it doesn't become that challenging anymore. All of a sudden you can actually see what you're doing rather than
Perfect.
just having a
Yeah.
direct vision.
Absolutely. All right, sir. You trained for MDS. We'll talk about. We want. I want to talk about. Okay, what's your opinion about whether people should do MDS if they want to stay in Pakistan? Should and specialize in Pakistan? Should one choose MDS or FCPS? And what was your reasoning behind choosing MDS?
Um, Again, क्योंकि मेरा exposure was not that of someone who was already based here. So a lot of my experiences come from my undergrad years. So we had a lot of seniors, we had a lot of you know people who were doing FCPS training, who were doing other forms of programs, basic sciences. So since the third year, me and my friends काफी इस conversation में indulge करते थे like all day कि अब आगे क्या करना है.
Hmm.
And the only option left was FCPS, right? कि FCPS ही रहता है सिर्फ.
Yeah.
I did give part one once, I'll admit it publicly, but I found the exam to be what's the right word for it? Not that streamlined कि आप उसकी
Yeah.
study guide देख के उसको
I
पढ़ें तो
know,
वो आपको
sir.
समझ में आ जाएगा कि आपने क्या
I
करना है.
completely agree. It's such a,
Yeah.
I don't know what that exam is. Anyway,
So yeah, I like to repeat this MCQ that keeps coming back to my mind, right? When I went for FCPS part one, so one of the MCQs, कि हमने 4 साल dentistry की है, but one of the MCQs was about the correct blood supply of the left ovary. And how the hell am I supposed to? And it would never even occur to me कि मैं मजीद anatomy पढूं, right? Because
yeah,
it's not part of the curriculum, and it wasn't even part of the curriculum for FCPS Part One dentistry.
yeah,
So I'd say it rather annoyed me कि
yeah. No,
unseen
I
किस्म की चीजें
understand. I
हैं तो
understand. Yeah.
कैसे achieve करना है. Right around the time MDS program was being advertised in University of Lahore,
Mhm.
and my supervisor Dr. Salman Ashraf, we had some interactions with him at some of the 3M workshops. So हम काफी intrigued थे कि एक अच्छा mentor हमें मिल सकता है इस program में. So we just went ahead and applied, and luckily we got in, और उसके बाद फिर हमारा काफी अच्छा exposure चलता रहा.
Very nice, sir. चलें,
Yeah.
that's perfect. All right, sir. आपने MDS किया and then you took the M.Endo exam.
Yeah.
जरा इसको explain करें. Like how did you end up taking the M.Endo exam? Because usually what I've heard is that people who've done Dent or MDS from जिन्होंने Saint Malaise से किया होता है. I know Dr. Aswand has done from Saint Malaise, and I know a few
University of Malaya. He's
yeah,
done from
sorry, yeah,
University of
Malaya, yeah,
Malaya.
yeah.
Yeah.
So exactly,
So
वहाँ से करके people have done M.Endo,
yeah,
but you,
basically,
yeah, yes,
देखो, Royal College of Surgeons is a separate entity जो के promotes excellence in medicine and
mhm,
surgery basically,
yeah,
and in dentistry. So the way they have their exams formatted
Hmm.
is they have exit exams. ठीक है?
Yeah.
So they have laid out a structure कि हमारी ट्रेनिंग की ये रिक्वायरमेंट्स है, और हमारे आपके ट्रेनिंग में ये बेंचमार्क्स पूरे होने चाहिए, जस्ट लाइक एफसीपीएस,
Hmm.
बिकॉज कॉलेज ऑफ फिजिशियंस एंड सर्जन्स is basically modeled after the Royal College of Surgeons.
Hmm.
ठीक है? It's a college on its own. It doesn't have programs that it teaches. Rather, it assesses programs taught on their curriculum in different
Okay.
universities and training institutes.
Okay.
ठीक है?
ये ठीक
सो
है.
ये एफसीपीएस का मॉडल यही है कि
Hmm.
आप ट्रेनिंग करेंगे कहीं और एग्जाम हम आपका लेंगे. ठीक है?
Absolutely.
जैसे यूएचएस is the university and it has its constituent colleges.
Hmm.
CPSP has training institutes
Training
approved by
institute.
them,
Yeah.
जहाँ पे
Absolutely.
उनके curriculum पे supervisors हैं and they
Right.
train you. So
Absolutely.
a lot of this training जो कि particularly orthodontics या surgery में है,
Hmm.
that has been widely recognized abroad for many years. तो
Hmm.
जब मैं अपने हाउस जॉब में था, and particularly when I was looking for programs, I had this curiosity
Hmm.
that why aren't endo programs or prosto programs or perio programs recognized to be eligible to sit these exams,
Okay.
right?
Hmm.
So this is a long process, right? Now I'm talking about when I was in my house job, मैं
Exactly.
program में
मैं भी
add
सोच रहा हूँ हाउस जॉब में आपको इतनी समझ कैसे थी. Wow, that's
because
amazing.
I was obsessed with choosing the right option. ठीक है?
Okay.
I can actually show you, and I think in one of my presentations, I actually displayed that during my house job years, I have a communication with one of the administrators at the Royal Colleges that I was inquiring them that there was this program advertised in Egypt, and I was asking them whether they would allow people trained in that program to sit their membership in endodontics exam,
Mhm.
right? And at that time, they sent me an entire document, जो कि अब it's easily found on their website.
Mhm.
Trust me, all of this information मैंने कहीं से इजाद नहीं की, मैंने कोई secret बंदा नहीं ढूंढा जिसने मुझे बताया. I just did my research
Research.
online,
Yeah.
और जहां मुझे कोई चीज समझ नहीं आती थी, I just emailed them and
Email.
asked कि
Yeah.
आप इसका क्या मतलब है.
Hmm.
So most of my understanding before I met some really good people who helped me came from just talking to them.
Mm-hmm.
और उसमें उन्होंने एलिजिबिलिटी क्राइटेरिया बताया कि इवन देयर इज वन वे कि आपके पास मास्टर्स डिग्री हो, दैट यू हैव अ मास्टर्स डिग्री फ्रॉम यूके और अ recognized इंस्टीट्यूट अब्रॉड. recognized इंस्टीट्यूट मींस करिकुलम उनसे अलाइन हो,
Yeah, yeah, yeah.
उनसे मैच हो. दे डोंट हैव टू एक्चुअली recognize it.
Mm-hmm.
ठीक है? दे जस्ट चेक योर करिकुलम, इफ इट्स द
Curriculum.
सेम एज देयर्स, सिमिलर एज देयर्स,
Yeah.
ट्रेनिंग पीरियड उतनी है, रिसर्च उतनी है, you're eligible to sit the exam.
Okay.
Or you have 3 years of clinical training in a structured program. ठीक है?
Okay.
अब इसकी interpretation is applied to FCPS, which is the only structured program
Mm.
in Pakistan at the moment,
Yeah.
and it applies to master's programs,
Mm-hmm.
which are fundamentally modeled after FCPS programs.
Right.
ठीक है? So
Right.
it's like a cycle, right? एक ही डिपार्टमेंट में FCPS ट्रेनिंग भी हो रही है, MDS ट्रेनिंग भी हो रही है, at least
Yeah.
in University of Lahore. The
Yeah.
same applies to DMont as well, or in
Yeah.
Multan as well.
Yeah. Yeah.
You have the same department, same supervisors, एक FCPS कर रहा है, एक MDS कर रहा है,
Yeah.
और एक दूसरे को अलाइन करके एक दूसरे को देख के ही उन्होंने डिग्रीज भी बनाई हुई है ना.
Yep.
ऑब्वियसली एक का असेसमेंट का तरीका फर्क है.
Yeah. Yeah. Yeah.
दोनों
Obviously.
दोनों प्रोग्राम्स के अपने एडवांटेजेस एंड
Mm-hmm.
डिसएडवांटेजेस हैं. सो आई फाउंड द अपॉर्चुनिटी कि आई कैन हैव माय ट्रेनिंग हियर,
Mm-hmm.
and to my perception I can be assessed by an independent organization which is, again, to my perception, unbiased, unfazed, doesn't hold any prejudice,
Yeah.
completely fair in terms of the examination, and is completely transparent in the
Yeah.
way they expect you to perform.
Yeah.
क्योंकि देखो, um, I did O levels and A levels and then MFDS and then M.Endo.
Mm.
And I'm also halfway through the licensing program in UK as well. ठीक है?
Okay.
इन सब के अंदर एक कॉमन चीज है कि जो ये आपको बताते हैं ना पहले अपने डॉक्यूमेंट्स में कि दिस इज
Yeah.
आवर करिकुलम, the examination always matches that. It's never out of place. So
Yeah.
if I go back, studying for M.Endo was like studying for A levels. ठीक
Yeah.
है? A levels में what the candidate is expected to know एडिशनल पॉइंट्स किस चीज के हैं, वही फॉर्मेट रॉयल कॉलेजेस
Yeah.
ने भी उस पर अपनी गाइडेंस बनाई है. So if someone is, dedicated enough, they can figure it out.
Yeah.
Obviously, लेकिन अकेले नहीं हो सकता. You need
Hmm.
some guidance. You need someone जो कि पाकिस्तानी सिस्टम या एटलीस्ट पाकिस्तान की डेंटिस्ट्री को समझता है.
All right.
And I was fortunate enough to, like you mentioned, Asfan, and I have my colleague now with whom I actually run the preparatory course for
Yeah.
the exam, Dr. Bushra. So these two people had a very key role in sort of pushing me in the right direction, and actually,
So
Dr. Bushra actually
basically,
coached
sir,
me.
MDS and FCPS both जो ट्रेनिंग करते हैं, can both of them take the M.Endo exam?
Yeah, so again, like a bit of trivia.
Yeah.
Before I had sent in the exact application,
Hmm.
उससे पहले I had not heard of, and I had been looking for over 4 years of my training कि मुझे कोई guidance मिल जाए.
Hmm.
उससे पहले, to this date, maybe if someone watches your podcast and they can correct this fact, मुझे उससे पहले, before 2019, I don't know of anyone who actually sat the exam after doing FCPS
Hmm.
or MDS from Pakistan.
Hmm.
एंड ये बात भी सच है कि इन 2019, बिकॉज दे ईज देयर क्राइटेरिया, उन्होंने केसेस की रिक्वायरमेंट निकाल दी, और
Hmm.
उसी साल उन्होंने एलिजिबिलिटी भी थोड़ी सिंप्लीफाई कर दी.
Okay.
देयर आइडियोलॉजी इज नाउ दैट दे गिव यू एलिजिबिलिटी, और फिर वो एग्जाम में असेस कर लेते हैं कि आप पास करने लायक हैं कि नहीं. वो
Okay.
पहले नहीं रोक देते.
Hmm.
Obviously, there are lots of reasons for them to do that as well. There are financial gains, and
Hmm.
there are other reasons कि वो अपनी अपनी जो growth है वो भी चाह रहे हैं कि global presence उनकी हो. They want more and more diversity
Yeah.
from different countries. So
Perfect.
ये reason थी कि it just happened to be coincident कि जब मैंने eligibility apply की, I already had MFDS, which is a general dentistry membership with Royal Colleges, और उन्हीं के college की थी. And
Yeah.
I had some guidance कि किस तरह apply करनी है eligibility. So I had eligibility very easily. In about 2 months time वो आ गई थी, वरना उसको तकरीबन 6 महीने लगते हैं.
Okay.
So उसके बाद when I sat the exam, then I found out, I'm talking about endo by the way, I'm not
Yeah.
talking
Yeah.
about prostho or perio,
Yeah.
क्योंकि यहाँ से मिसकंसेप्शन ये बहुत अरसे से था कि क्योंकि यहाँ ऑपरेटिव है तो वहाँ आप एंडो में नहीं बैठ सकते.
Yeah.
बट इफ यू
That was my
डिस्कस,
next question actually. Yeah.
या द थिंग इज कि अगर आप ऑपरेटिव कॉलीग से ये डिस्कशन करेंगे,
Hmm.
सो दे विल टेल यू कि सारी एंडो वो पढ़ते हैं,
Hmm.
एंड मेजॉरिटी ऑफ देयर ट्रेनिंग इज इन एंडो,
Yeah.
राइट.
Absolutely.
सो दिस वाज अगेन माय क्यूरियोसिटी, या मेरा मेरा मसला था कि जब आप एंडो आपके मुल्क में ऑपरेटिव के नाम पे पढ़ाई जा रही है,
Hmm.
तो आप रॉयल कॉलेज को ये बात एक्सप्लेन कर दें,
Yeah.
आप उनको डॉक्यूमेंटेशन दिखा दें. एंड आई डेंट मेक अप एनी सच, आप कह लो, फेक चीज. मेरी एमडीएस ऑपरेटिव डेंटिस्ट्री की सारी ट्रेनिंग थी. एमडीएस ऑपरेटिव के अंदर मेरे पास जो बहुत बड़ा एज था, दैट वाज दैट वी हैड अ माइक्रोस्कोप. ठीक है.
Hmm.
आई रियली गिव अ लॉट ऑफ क्रेडिट टू दैट एंड टू
Yeah.
देयर मैनेजमेंट कि उन्होंने उसे अटेन किया. तो
Yeah.
उस सब को मैंने इनकॉर्पोरेट करके इन राइटिंग आई शोड देम कि जो आपके आवर्स हैं और जो आपका करिकुलम है वो
वो
मेरे
हमारा.
प्रोग्राम में इंक्लूडेड है.
Yeah.
एंड दैट्स ऑल दैट दे नीडेड. उसके
Wow.
बाद से देखो, दैट वाज अ प्रेसिडेंट केस, राइट.
Yeah.
मी सेटिंग अ प्रेसिडेंट. उसके बाद से FCPS, yeah, even MDS programs, they don't need to now get eligibility separately.
Hmm.
Now the Royal Colleges recognize programs from Pakistan, और
Hmm.
वो उनको डायरेक्टली एग्जाम में आप बैठ सकते हैं अगर आपके पास
Wow.
ट्रेनिंग पूरी है तो.
Yeah.
दैट्स ऑब्वियसली द प्रीरेक्विजिट
Wow,
कि
sir,
ट्रेनिंग पूरी होनी चाहिए.
you must be very proud of this. I'm sure because काफी सारे ट्रेनिंग्स
यार,
भी आपने
या
जिनके साथ काम
मतलब
करा.
it makes me really happy कि finally there's a newer option कि,
Yeah.
and it sort of proves the point कि आपकी भी ट्रेनिंग जो है वो, if you are the right candidate, if you put in the right effort, so
Yeah.
आप किसी से कम नहीं हैं. So यहाँ बैठ के भी आप उनके ब्रिटिश कैंडिडेट्स के साथ compete कर सकते हैं. You can pass the same exams as them. So
Absolutely.
it's no rocket science to it.
Absolutely, sir. Absolutely. All right, sir. You're currently working as the head of department of endodontics and an assistant professor. Sir, how is this experience been working at Azra Nahi Dental College? Because you're now heading a department. How is that experience?
It's so far it's been great. right? So I have the opportunity, जो कि I've been fortunate enough to have this opportunity. बहुत से colleagues को ये काफी later in life जाके ये chance मिलता है कि वो किसी चीज को अपने हिसाब से चला सकें.
Yeah,
And I take this as an advantage कि at this point a lot of the knowledge and experience that I have, particularly from my exposure with the interacting with people from abroad.
yeah,
So I'm able to implement a lot of the good things we've learned abroad,
yeah,
from colleagues abroad into our practices here.
yeah.
Based on, can you hear me? You're
Yes,
breaking
yes,
up
yes,
again.
yes, I can, sir. Absolutely, I can.
Yeah, because your video got stuck, huh?
Yeah,
So basically, yeah, देखो, we're always gonna have our limitations. Our
yeah,
limitations is gonna be we're a third world country.
yeah,
There's no denying that. We have limited resources. लेकिन हमारा advantage है कि हमारे पास patients के numbers ज्यादा हैं.
yeah,
So अगर आप कुछ fundamental चीजों को start ले लेना, so that brings up a very good base to set up a good platform for training. For
yeah,
example, um, rubber dam is something जो कि
yeah.
normally colleges के अंदर strict compliance नहीं होती.
Sir,
So
that's
that's one of
exactly
the
what I was
first
about
thing
to say.
that after
That
being the head.
Yeah, exactly. I'm
Yeah.
sorry I cut you off, but I've
So
heard this that Dr. Nabeel uses. I've heard this from your demonstrators, and I've heard this that Dr. Nabeel is very strict about rubber dams, and he uses a rubber dam even for a filling. So that's strict compliance of that is very important. It's the gold standard. So that's a huge deal. Exactly. Working as the head of department, obviously, एक चीज आपको implement
so
करना है,
देखो,
तो very big deal.
it's मैं at this point I'd make a correction. It's not the gold standard. It's
Okay.
rather called the standard of care. ठीक है?
Okay.
It's the minimum standard. It's not the
Okay.
highest level that you're actually achieving. It's the
Yeah.
minimum. हम एंडो की बात कर रहे हैं. I'm not
Yeah.
talking about other specialties again.
Yeah.
I'm at such a point कि I don't think कि you would consider this a big deal कि अगर मैं college के अंदर where I am the head, I'm using a rubber dam.
Yeah.
I'm using the rubber dam in private practice when I'm just alone working with a patient and there's no one actually watching.
Hmm.
Okay? That is where I'm more comfortable in using a rubber dam because that's where I'm charging the patient good money.
Hmm.
And the rationale behind it is कि जितना बेहतरीन आप काम करेंगे उतना ही आपका patient भी खुश होगा. Because at the end of the day, we're all clinicians. So
Yeah.
the rubber dam not only provides safety to me, मेरे लिए बहुत तसल्ली है कि I'm not gonna have clumsy hands and throw something down the patient's throat.
Yeah.
There's a concentrated irrigant that we're using, उससे patient damage नहीं हो सकता. And patient की तंग नहीं करती. There is no contamination. और मुझे तसल्ली है in using the full width of my knowledge in treating that tooth because it's just me and that tooth.
Yeah.
जब तक कि वो आइसोलेट नहीं हुआ होता, वो आपके लिए एक पेशेंट है. वो
Hmm.
आपके लिए एक बंदा है जिसने उठ के स्पिट करना है, जो कि आपको इंटरप्ट कर सकता है, जिसने आपसे बैक एंड फोर्थ बातें करनी है.
Yeah.
But if it's a difficult case, as soon as the rubber dam goes on, that's just now you, the dentist, and that tooth. And the other, जैसे बात वो रेफरेंस पॉलिटिकल हो जाएगा, लेकिन जैसे मियां साहब कहते हैं ना, लेवल प्लेइंग फील्ड चाहिए. लेवल लेवल
Yeah.
प्लेइंग फील्ड मिल जाती है दांत के साथ आपको.
Yeah.
सो
No,
सो
sir, you're
इट्स लार्जली
absolutely
यू.
right. And kudos to the fact that you're जो आप प्राइवेट प्रैक्टिस में स्टैंडर्ड प्रैक्टिस कर रहे हैं वही आप एक टीचिंग हॉस्पिटल में कर रहे हैं वेयर द
या
प्राइस ऑफ द ट्रीटमेंट इज relatively much cheaper than
या
what we usually charge in private practices. So it's a very
या
big deal, and I'm sure college का भी बहुत फायदा होता होगा इस चीज़ से. Sir, I'll
या
move on towards the end of this interview.
या
You're, I won't call you a fresh graduate, but it's been a while since you graduated. Sir,
या
आप एक नया बच्चा जो ग्रेजुएट हो रहा है, अब जैसे मुझे ग्रेजुएट हुए 1 साल हुआ है, so I'm kind of a fresh graduate. What advice, career advice, or just holistic advice would you give a fresh graduate who's graduating as a dentist right now?
या सो यार, based off of my experiences ना,
Mhm.
the best thing is कि आप don't do monkey see, monkey do, right? You have to figure out, you have to go on your own journey.
Yeah,
You have to establish or sort of set out your own goals. You have to recognize कि आप इस profession से क्या चाहते हैं. Is
Absolutely.
it teaching? Is it patient care? Is it clinical training? Where do you see yourself when you're at the end of your studies?
Hmm.
If that means कि आप पढ़ा भी रहे हैं और आप थोड़ा सा बिट ऑफ बोथ कि आज जी आप पढ़ा भी रहे हैं आप क्लिनिक भी कर रहे हैं, then you can go along that path. If you see yourself as a clinician, then you have to again consider the facts कि how much finances do you actually have. Do
Hmm.
you have the funds to actually go abroad
Hmm.
on that really expensive and difficult journey
Yeah.
कि आप बाहर जाएं, आप पैसे खर्चें, आप वहाँ ट्रेन करें, एंड देन फैमिली कम्स इनटू प्ले कि आपके फैमिली फैक्टर्स क्या हैं.
Yeah.
So this is a very relative thing,
Relative.
and it
Absolutely.
should never be one. Any fresh graduate should never follow someone that they think
Hmm.
has their goals. उनको
Hmm.
ये लग सकता है कि यार मुझे इसका मुझे जो करियर है ना, ये आई थिंक दिस इज अ गुड, ये ठीक है, सही है,
Hmm.
ये सही जगह पे पहुंच गया है, आई
Hmm.
शुड डू व्हाट ही डज.
Yeah.
बट यू डोंट नो कि उसके रीजनिंग क्या थी, उसकी मोटिवेशंस क्या थी. सो यू हैव टू फिगर दैट आउट on your own. So you have
Perfect.
to do a lot of self reflection
Self-reflection.
right around the time when you reach final year. And
Yeah.
house job is the best time. वैसे वो सबकी कोशिश होती है to chill, लेकिन house job is the best time to actually stretch your wings and see कि आपको specialty क्या पसंद है, whether you want to get into clinical basics में
Yeah.
जाना है, क्या करना है. That is the right time. But
Perfect, sir.
do your own thing. Do your own thing. Be original. Don't follow other people.
That's beautiful advice, sir. Sir, लास्ट 2 और 3 क्वेश्चंस. फ्यूचर में नेक्स्ट 10 years में कौन सी एक, इफ एक टेक्नोलॉजी कौन सी ऐसी है एंडोडोंटिक्स में जो आपको बहुत एक्साइट करती है अपकमिंग 10 years में, जो टेक्नोलॉजी आपको एक्साइट कर रही है?
Yeah, there's some wonderful work being done on irrigation techniques,
Okay.
or this sort of, at the moment, it's not exactly a newer technology,
Hmm.
लेकिन उनका क्लेम ये होता है कि वो अपनी एक्टिवेशन के जरिए ही आपको मैकेनिकल प्रेपरेशन नहीं करनी पड़ती.
Oh,
या
wow.
some instruments like the self adjusting file के वो फाइल ही internally irrigated है. So again, they're not new, लेकिन
I did not know about this.
या
That's very
डायग्नोस्टिक्स के
interesting.
अंदर जैसे अब सीबीसीटी आ चुका है,
Yeah.
that is a game changer. Guided endodontics, or yeah, again, you would really like this. There's this contraption called the Navident. ठीक है?
Okay.
So the Navident is basically a real-time superimposition of CBCT slices via a virtual headset while you're
Oh,
actually doing endo.
wow.
ठीक है?
That's
So
so
you have
exciting.
a headset, on, और उसके इसके हेड्स अप डिस्प्ले के अंदर आपने दांत को कैलिब्रेट, वो डिवाइस पूरी ऐसी होती है कि आपने टूथ कैलिब्रेट किया होता है, एंड
Yeah.
द सीबीसीटी ऑफ दैट टूथ इज अपलोडेड इन दोस गॉगल्स, और आप उसको रियल टाइम में अपनी आंख के सामने, you can have a superimposition
I
of
have
that.
goosebumps right now, sir. That is so exciting. That is
Yeah,
actually very exciting.
it's really brilliant.
Is it
US,
like, where is this? America, Europe,
America
Japan?
and Canada.
America. Wow.
अमेरिका एंड कनाडा.
Yeah.
बहुत बहुत कम है, ज्यादा नहीं है,
Yeah.
लेकिन या इट्स अ थिंग ऑफ इट्स ओन यार. वो तो मैं उसको शायद
Very
डिस्क्राइब भी
exciting.
ना कर पाऊँ कि उसका प्रोटोकॉल क्या है. आई डोंट नो,
Yeah.
लाइक आई हैव सीन इट बीइंग यूज्ड, एंड वो आप you're looking at the tooth and it's like you're looking at the tooth
Yeah.
and you put on a filter, जैसे पिक्चर का फिल्टर होता है,
Yeah,
तो
yeah,
वो
yeah,
अपनी
yeah.
सीसीटी को सुपर इम्पोज कर देता है दांत के ऊपर कि कोई आप चीज मिस तो नहीं कर रहे.
Wow,
सो
sir.
या,
That's actually
दैट्स
very
रियली
exciting.
ऑसम.
All right, sir. Jaldi se tell us about a time that you made a mistake and then you covered it and then you had to cover it up because हमें HODs अपने लगते हैं that उनसे गलतियां होती नहीं है, ठीक है?
Like,
And
do you mean with patience?
yeah, with the patient के patient में गलती हो गई है, then how did you manage it? Because होती हैं.
यार देखो, if you haven't made mistakes, like you haven't learned anything,
Yeah.
right? So and in the beginning, particularly with आप कह लो जो hand pro tapers थे,
Hmm.
I didn't have exact understanding कि उसकी force कितनी होनी चाहिए.
Okay.
So मैं तो बस जोर जोर से ना घुमाता था initially when I started off. So it was a young patient, and बड़ा अच्छा treatment उसका start हुआ, normal filing की. I was in a rush,
Hmm.
ये मैं जल्दी में था, आई वांट टू डू अनदर केस. तो मैंने उसकी जो है ना यंग पेशेंट के दांत में ना फाइल तोड़ दी,
Oh my God.
एंड देन इट सॉर्ट ऑफ रूइंड माय डे. और फिर क्योंकि कुछ चीजें तो आपने, मैंने एमएफडीएस में भी बहुत आप कह लो वैल्यूज को समझा था, सो आई हैड टू एक्सप्लेन टू द पेशेंट And
Hmm.
obviously she wasn't happy. उसके parents साथ थे. It was a young girl. The parents got really angry. वो उन्होंने complain कर दी हमारे HOD को. And then obviously उन्होंने फिर cover किया
Yeah.
because when you're in such a position, you know कि इस तरह के incidents हो सकते हैं, and then you have to step in and sort
Yeah.
of cover your trainees, right? और
Yeah.
फिर someone senior took over the case. उन्होंने उसको manage किया while I was just standing and watching.
Yeah.
Felt really bad. लेकिन फिर उससे एक चीज जो सीखी ना कम से कम, that you never be in a hurry to do endo. If you are in the middle of a case, you feel anxious, you feel कि यार मेरी बस हो रही है, just stop before you
Stop.
make a
Oh
mistake.
wow,
वहीं
that's
बंद
really
कर
good
दो,
advice.
come back again. It's so much better
Yeah.
than doing something worse and then not being able to fix it. Many
That's
times, बहुत दफा होता है endo करते हुए कि आप you're looking for a canal and आप ultrasonic से उसको you keep troughing, you can't find it. You're visually you're exhausted,
hmm.
physically you're exhausted. You
Yeah.
just stop, you bring the patient in the next day, and आपको वो 2 मिनट में मिल जाता है because you
I
were just really
you're
tired.
absolute
ठीक
because
है?
the thing that you said visually exhausted वाकई में आपको
Yeah,
नजर आना बंद हो जाता है.
yeah,
It's as if
बिल्कुल
आपको
बिल्कुल.
नजर ही नहीं आ रहा होता, वो जो फाइल्स
Yeah,
ढूंढनी होती है वो भी नहीं नजर आती फिर.
yeah, ऐसे ही होता
Yeah,
है. So
बिल्कुल
that's the
सर.
best thing.
Yeah, you're that's brilliant advice, sir. Sir, last question. What do you think about this startup of ours, this platform of ours, and what advice would you like to give us? Jaldi se.
Yeah, I think anything associated with social media these days,
Hmm.
jiski reach has expanded from just a couple of people in one institute to a global presence, right?
Yeah.
Is is something that has a huge impact. Already, you're in a position to tell the world that we are here, and
Hmm.
you're in a position to explore other aspects of dentistry on these platforms. So
Absolutely.
it's a plethora of information,
Hmm.
क्योंकि information की भरमार आजकल हर जगह पे ही है.
Yeah.
So this is like such it's not an innovation on its own,
Hmm.
but it's such a good use of this platform कि आप अपने profession को expand कर रहे हैं, अपनी
Yeah.
presence online दिखा रहे हैं, and you're able to interact with people from other cultures, other nationalities, and you
Yeah.
get to know their perspective as well. तो इससे म्यूचुअल लर्निंग के अंदर बहुत ज्यादा असर है मेरे हिसाब से तो.
Thank you, sir. Thank you so much for that, for this whole
Yeah.
interview. It really meant a lot to me. Thank you so much for taking time out. I know आप थके हुए होंगे. सुबह college, then clinic, and then the course, and now this. So thank you
Yeah.
so much for
No,
taking
it's
time
fine.
out. It really
It
meant
was
a
a
lot to
pleasure to
me.
be here.
It really
Yeah.
meant a lot to me. And see you tomorrow, inshallah. Allah
Yeah,
Hafiz.
see you tomorrow.
Allah
Chalo,
Hafiz.
Hafiz.